a patient with hantavirus walked into one of Europe's top hospitals, and the staff treated them like they had the flu. 12 workers at Radboud University Medical Center in Nijmegen, Netherlands, are now spending 6 weeks in quarantine because they forgot to follow a safety protocol designed for one of the deadliest viruses on Earth. The patient had just been evacuated from the MV Hantavirus cruise ship, where a hantavirus outbreak was spreading through passengers and crew. Hospital staff knew what they were dealing with. They had the protocols. They had the equipment. But when it came time to draw blood and collect urine samples, they didn't use them. The strict biosafety measures that exist specifically for handling bodily fluids from high-risk pathogens, the masks, the gloves, the containment procedures, were simply not followed. And now a dozen healthcare workers are waiting to see if they were infected. Hantavirus doesn't give you a second chance. Depending on the strain, between 20 and 50% of people who develop symptoms die, even with treatment. The version linked to the cruise ship outbreak appears to be the Andes strain, which has a mortality rate near the top of that range. It attacks the lungs, filling them with fluid until breathing becomes impossible. Early symptoms look like the flu, a fever, muscle aches, fatigue, but within days, patients can spiral into respiratory failure. There is no vaccine. There is no specific antiviral drug. Treatment is supportive care in an intensive care unit, and for many, that's not enough. The virus is patient. The incubation period stretches from a week to 6 weeks, which is why the quarantine lasts that long. For the next month and a half, those 12 workers will live with uncertainty. They'll monitor for fever, for shortness of breath, for the telltale signs that the virus has taken hold. If symptoms appear, they'll be rushed into isolation and placed on the kind of intensive respiratory support that can mean the difference between survival and becoming a statistic. What makes this incident so unsettling is not that it happened at a small rural clinic or an overwhelmed emergency room. It happened at Radboud University Medical Center, a major academic hospital with cutting-edge research programs and the kind of institutional knowledge that should make protocol failures nearly impossible. These weren't untrained volunteers. They were professionals who handle infectious diseases as part of their job. They knew the patient had been on the Hantavirus. They knew hantavirus was confirmed. The hospital has publicly acknowledged that staff did not follow the specific, strict protocols required for handling blood and urine from infected patients. The MV Hantavirus outbreak is still unfolding. Passengers have been hospitalized across South Africa, Germany, Spain, France, and Switzerland. The ship, which normally carries adventurous travelers to remote destinations like the Canary Islands, became a floating epidemic. Health authorities in multiple countries are tracking potential cases. In the United States, 18 passengers were flown to medical facilities in Nebraska and Atlanta, with at least one confirmed positive and another showing symptoms. The global response has been massive, coordinated, and urgent. But the 12 workers in Nijmegen weren't passengers caught off guard by an invisible threat. They were the last line of defense, the people trained to contain exactly this kind of danger. And somewhere in the chain of decisions that morning, whether it was overconfidence, miscommunication, or simple human error, the protocol broke down. Blood was drawn. Samples were handled. And the virus, if it made the jump, is now counting down its incubation clock inside people who were supposed to be protected. The hospital has not released the names of the workers or specified exactly which safety steps were skipped. What's known is that the procedures exist for a reason. Hantavirus in blood and urine is infectious, and without proper containment, exposure is a real risk. The 6-week quarantine is precautionary, but it's also an acknowledgement that the risk is serious enough to remove these workers from duty for more than a month. This is what institutional failure looks like at the micro level. Not a policy disaster or a budget cut, but a moment when the gap between what should happen and what actually happens turns into a potential death sentence. 12 people are now living inside that gap, waiting to find out if a lapse in protocol will cost them their lives.